Hi.
My name's Andrea, and I got your case from Brad Taylor, and he went ahead and did your assessment. And today I'm going to be going through your treatment plan and our case management services here. We did see that you met the criteria for alcohol abuse, so that's what we're going to be basing our treatment plan on. The treatment plan is just an outline of some of your goals, short-term, long-term. And as for case management, once we get your treatment plan and everything worked out, what we're going to do is we're going to get in contact with your PO and send him over everything that you're going to be doing, your start date, your end date, everything that you need to be doing in order to comply with that. And then that'll go on your record that you've attended. So the first part of your treatment plan is going to be 12 weeks of outpatient group. It's 1.5 hours once a week. You're required to attend 10 AA meetings. You have to have the first one done by your 3rd week, and then we like to have you do one each week. So it's preferable that you don't wait until the last minute and then do 10 in 5 days. And what we'll do is we'll get you a list of everywhere in the 7 cities that have meetings. They have a morning, noon, night, lots of different places. So that shouldn't be too hard to accomplish. Also, you will be drug tested at least 5 times during the program, with one of them being a random. So we'll call you on Thursday night, and then you'll have to be there Saturday morning in between 8 and 10 to complete a drug screen or to complete a breathalyzer. Each time that you come into group, you will be breathalyzed. If your breathalyzer comes back as positive, then we have to have somebody come and pick you up from the center, and that'll result in what we call a clinical response. A clinical response is, to put it into easy to understand terms, it's basically you're going to get something added on. You're going to have extra breathalyzers, maybe extra drug screens, and probably a 4-week extension. So you do not want to do that. So always make sure that you call and make sure that you're not on the Saturday drug screen list. Also, that's the first part of your treatment plan. That's the part that we design. The part that you help design is your short and long-term goals. So I know that you have lost your license because of the DUI. So I know that it's a problem for you to make it to group. So why don't we make one of your short-term goals getting to group? So what do you think that we can do to make sure that you have transportation to group?
To ride the bus. Give me a bus schedule.
Okay, you can ride the bus. Can maybe ask a friend ahead of time if he can take you on that certain day. I don't know how far away you live, but a bike may not be a bad idea if those two things, fall out. We can do that. What is another short-term goal that you have?
Getting back into school.
You want to get back into school. Okay, were you attending school previously? Okay, and did you drop out, or
Dropped out.
You dropped out? Okay, so getting back into school is another short-term goal for you. What do you think that you could do to get back into school?
Just focus my attention on it.
Okay, so you're going to probably need to make some phone calls and figure out exactly what you need to do. And again, when you come in for case management services, for whether it be an hour a week, or you can schedule that. It's not required, but you can always call and say, like a case management interview, and we can get that together for you. And we can help you get with who you need to get with at the school to figure out what you need to do to get back into it. So we need to find out things like when the semester starts, financial aid, things of that sort. And your case manager will be more than happy to help you with that. Okay, as for a long-term goal, what do you see?
Not getting in any trouble anymore and getting my license back.
Okay. So not getting into trouble anymore. So that would basically be like staying sober.
Yeah.
Because all of your trouble has kind of been centered around drinking.
Mm-hmm.
Okay, so if we're going to stay sober in the long term, one of the things that we need to do is we need to complete this treatment program. That would be the first step. We can continue to go to AA meetings even after treatment, even after your 12 weeks is done here. A lot of people find them really helpful. We can also help you get a sponsor. You can find a sponsor that will help you through stressful times when you may feel the need to drink or be around a trigger that may make you want to drink. A sponsor can be there to help you through those times. So that's always a really good idea to have. We always encourage everybody to get a sponsor because that's something that you can take after group and treatment is over, and that can be part of your support system after we're done. Okay, so basically those are our short-term goals, is getting you to group, which is an immediate need because you have to be here, and getting back into school. And so we've kind of outlined things that we need to do to accomplish those two things. And your long-term goal for now is just staying sober. And so we discussed we need to do AAs after treatment, we need to make it through treatment, and we need to find a sponsor. So now what we'll do is I'm going to get with your PO, and you said that that was with Chesapeake Bay ASAP. So I will be contacting them and letting them know about your treatment plan and that you have come in, you've gotten the assessment done, and I'm sure that they'll be happy to hear that. And then they can get with you on what they want you to do next. And each month we'll be sending them a progress report of everything that you've been doing, your breathalyzer results, your drug tests, everything like that. But it's only factual information. It's not going to be anything you say in group or anything that you divulge to us. It's only going to be, okay, he was negative, all of his breathalyzers have been negative, all of his drug screens have been negative. So it's just going to be factual information, so you don't have to worry about that we're going to tell your PO anything that you say in group. So how do you feel about what we've just went over?
I have to do it, so.
Pretty good. Do you have any questions for me?
No.
Okay, well, we will see you next week at group then at 6 o'clock. All right, thank you very much.